Growing up, you would hear stories about people who are sick and they don't know what that person has, and then that person is at home, they eventually die. It happens to a lot of people, my grandma being one of them. And if you really look at it, a lot of people really actually die because of the limited diagnostics. I grew up in Rwanda and I came to the US for college. When I was still at MIT, I was also working at a lab that was working on developing different diagnostics technologies. And when I was doing research, I realized that medical imaging is one of the most challenging problems, especially in Rwanda today. So in Rwanda, in 2019, we had about 12 radiologists with a population of 13 million people. So that's slightly less than one radiologist per million. But if you look, for example, in the US, you realize that they have about 100 radiologists per million. And this directly translates to the experience of patients who they can't get treated because they have to wait for more than 2 weeks to actually know whether you have cancer. And those 2 weeks, sometimes it's a matter of life and death, but also the big challenge is what it means economically. For example, a patient in Rwanda who lives in a remote area, because in Rwanda, all the 12 radiologists I talked about, 9 of them are based in Kigali, the capital city, and yet Kigali only has less than 10% of the total population. So this means that if you live in a remote area, it means healthcare is going to be more expensive. We believe that teleradiology is a promising solution and it has been shown to work in different places around the world. If you can have a teleradiology solution where remote hospitals that don't have radiologists send images to a diagnostic center or to a different hospital, you can have radiologists in one area and be able to tackle the diagnosis of the most life-threatening diseases. Healthcare especially is a challenging industry because a lot of things need to go right, from the technology, the investment, the regulation. And we believe that the HealthTech Hub really helped accelerate all of those key dimensions that we need to succeed. So we are very excited and we are especially happy that the solution that we are working on has been brought to the attention of the government as well as the investors.